All right, so hi, everybody. I am Christie Bates of the Embracing Simplicity Contemplative Order and also of Positive Counseling and Direction, and also a member of the Brainspotting Mississippi group. And I have the honor here of getting to interview Tracy Gantlin Monroy, MDiv LPC in Atlanta, Georgia. And she is a licensed professional counselor, a certified brain spotting practitioner and consultant, and a visionary that drives the Grace Community Counseling and Social Services LLC in the Metro Atlanta area. And I got a chance to attend Tracy's brain spotting, intersectionality and social justice training a few weeks ago. And she very kindly took interest in the Brainspotting Mississippi passion and was willing to be interviewed for us here to help my fellow clinicians in Mississippi and the surrounding areas understand my passion for helping people get trained in brain spotting and get some of the benefits of that here in Mississippi. So, so Tracy, some of the clinicians, already watching this, obviously some in the Brainspotting Mississippi Facebook group and other colleagues of mine, they may already know about brain spotting and have heard the phrase, where you look affects how you feel, but we all probably have our own ways of describing to clients what this is that we're doing. And I'm just curious, how do you introduce it to your clients and to colleagues when they ask what brain spotting is?
Thank you, Reverend Christie. And just want to say thanks for having me here. And I'm glad to be here. And I'm excited to always talk about the helping professionals and brain spotting, as I have found it to be tremendous in supporting clients gain access to those areas that talk therapy doesn't always latch down as expeditiously. And so even when it comes to introducing brain spotting, just know that I give that invitation and introduction just about every day of my life. And your question takes me back to being on a catamaran in Mexico last October. And we were with a group of people, my husband and I, and there happened to have been a psychologist on a boat, and there were also people with trauma. And so in having the conversation, a lot of it depends on the audience and the person and where they are. And I usually look for something that's familiar. Oftentimes I've been quoted as saying that I speak to people about the trauma network to kind of give a context. Oftentimes I'll use like your cell phone location, your cell phone map of coverage, which used to be a big thing. Now it's almost outdated. But I share with people that sometimes our trauma network can be quite similar to our cellular coverage in terms of what that map looks like and how we have these different dots that show where we have coverage. The brain can be the same way when it comes to our trauma network, that we have different traumas, and that depending on what the trigger is, how it can illuminate particular traumas. My mind goes back to PTSD. I just spoke with someone this morning about the PhD program in brain spotting. That called me from Dominica, so I apologize for misspeaking. But I share with people about where you look affects how you feel, having to do with how the brain is configured. And I share with people the difference in the top thinking brain and then that midbrain with that subcortical brain, which is our feeling brain. And I share how brain spotting bypasses that part of the brain and that how it can go right there and access that area. And as a clinician, understanding that brain spotting is relational and neurobiological. With that being said, I share about the field of vision, and I allow people to know how we go through the optics, through the eyes, and how the eye is connected. And that when it comes to trauma, my role as a clinician has to do with holding that space and allowing the brain an opportunity to process those events. And when I share that, they're pretty amazed. And then the greatest way I have found is with the demo.
Yeah.
Right. And so when we start talking about where we look affects how we feel, I just share a little bit about how the brain thinks about what we look at. And that becomes the focal point. And so with that, and when I have people go to the left, to the middle, and to the right, I'm using my head, but I have them do it with their eyes,
Right.
And them just noticing the impact of that. And so that's kind of how I introduce it experientially.
Yep, of course. Yeah, that makes sense. Yeah, you're reminding me of, when I came across Brainspotting, I was newly hired as the contemplative therapist, or we created this contemplative therapy program at the ranch outside of Nashville when I worked there. And so because the clients I was working with were groups of people interested in mindfulness and contemplative practice, in that world, there's often a statement you hear of turn toward your suffering and being willing to sit with it. And so it wasn't a very big leap to help people know that we're literally turning toward our suffering with our eyes. Even if we're sitting in meditation with our eyes closed, when we're really in touch with what we're processing, our eyes are there. And so helping people become more aware of that kind of made a natural bridge. So just the thing you were saying about how the audience you're talking to really affects how you present it makes a lot of sense to me. So yeah. Now I remember reading on your website that your clinical supervisor pegged you as a future brain spotting professional from the beginning, which just tickles me. And I'm wondering, what did she see in you that let her know that would be your interest? And what's it been like for you, that journey?
The journey has been just stupendously fruitful. And when I say that, the proof is in the pudding. And so Janie Smith, I love her. She has since retired, was my supervisor when I was an associate licensee. And she had a really good barometer of who TG, as I'm affectionately called, who TG is or was. And she readily picked up on my spiritual underpinnings. And I was kind of out of the box already as a newer clinician. And so one day during supervision, there was a group of us actually. And she said, and she still calls me TJ to this day. And I keep saying Miss Janie, tall and gorgeous, TG. And she says, TJ, I know your tribe. I was like, oh, you do? Where's my tribe at? She said, brain spotting. Because she picked up on my intuitiveness and my insight, which she and I and everyone else that encounters me knows at that time, my limited time in the field had nothing to do with experience of my presentation. It was intuitive. And so she mentioned brain spotting to me. She began to demonstrate brain spotting. She began to use brain spotting. And she did say, she says, you're going to have to wait until you're fully licensed to afford it. I was like, oh, it's like that. She was like, it's like that. Because she knew what I was making at the agency. I think during that time it was like $35 an hour. Nonetheless, it stuck with me. And the things that she imparted to me, I used in community illegally. Let me say that. Because, you know, being at a agency with Medicaid clients is synonymous for audits, right? When it came down to that note and things of that nature. And it was actually my colleague who was an assessor, and her name is Tracy as well. And she said, I don't know what you're doing, but when your clients and patients come in and I assess them initially, they appear half dead. She says, and when I go back for renewal for the insurance, they've started businesses. They're up and moving. They're out of the bed. Da, 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 da. And she's like, you really ought to go into private practice so that you can do your thing, because, you know, insurance companies constrain us, right? They're the pocketbooks, but they want to advise us on how to move with clients based upon what they're willing to pay for. And so when I say illegally, in the midst of my sessions, I would throw in a little brain spotting, and I would always get my clients' permission. And my famous last words are, you want to try something? And they would say, Miss Tracy, what are you talking about? I'm like, let's try it and see how it goes. And so when Miss Janie informed me, when she understood who she was dealing with as a baby clinician, she blessed my life, you know. And so I followed up when I became fully licensed and reached out to Miss Janie to consult on private practice. And I said, Miss Janie, you have introduced me to EMDR and brain spotting. Which way do I go, or both? She said, forget about EMDR, brain spotting all the way. Here I am.
Mm-hmm. Yeah. Boy, those people that can really see our gifts are such a blessing, you know, I mean, to the whole world, really. Yeah. Yeah. That's it. Well, I was really interested that when you're talking about, you know, doing brain spotting illegally, because that kind of really leads into my next question. Because, you know, in our community of brain spotters and in our trainings, we hear about brain spotting. We hear it spoken of as an actively anti-oppressive model, and that is one of the messages that I really want to carry to clinicians in Mississippi. And so you know, when I think of that, I think about the ways that sometimes people are trained. I also had a good clinical supervisor who was all about maximizing my attunement and all of that. So I was fortunate in the training I got. But for the bulk of us, our training is all about you know, manipulating people into compliance. And if somebody's not complying, then they're considered resistant and all of that. And so, you know, how is it that brain spotting offers such a different view of the therapeutic relationship? How is it anti-oppressive?
So even in my training, brain spotting, intersectionality, and social justice, so I have been tremendously blessed by and through and with brain spotting. I came into brain spotting at about 300 pounds. So let me say that part of what, I don't know, even a word that would encompass what that experience was like, because I actually received healing in a brain spotting training. Okay. And so when I promulgate about brain spotting, I'm not just talking about the halo that clients see around my bun or the silhouette that's been on the wall, where clients would say, Miss Tracy, there's a silhouette of you. Oh my God, your aura is white. Your aura is, and I'm like, okay, I don't know what the hell is going on here. And I would go into consultation and I would say, Cynthia, what am I doing? What is going on? And there was even a situation where I was sitting with the client, had checked spatially if I was far enough, needed to be closer or what. And literally, as I was sitting with the client in office, previous COVID, I could feel a magnet, literally, between me and that client. And I thought, all right, spirit. And so when I think of anti-oppressive, what resonates and what I talk about even in the training, brain spotting, intersectionality, and social justice, much of it comes out of sitting with Dr. David Grand. I affectionately call him David. When you start the Dr. David Grand stuff, he is like as a sheepish boy and says, just David. And I'm like, okay, David. But in having dialogue, when I presented to David what I wanted to do, what I needed to give birth of, and what was in me, it had everything to do with the unrest in 2020 that our nation saw. I became angered, I became fearful, and all these things. And so as we sat around, my vision, my passion, the anti-oppressive piece was for me that I don't get to tell someone how to be and who they are, because brain spotting is relationally and neurobiologically. So as a Black American woman that stands 6 feet tall, that has a certain type of articulation, spirit, energy, presentation, and things of that nature, I know what oppression looks like, feels like. And so the last thing I ever want to do is to create a box for anyone. So brain spotting is so expansive that you don't have to be any particular way. You don't have to do any particular action. The anti-oppressive piece speaks to culture for me, because so often, systemically, marginalized persons of color have these expectations that are overt as well as covert, right? Whereby that whole dominant cultured, those nuances, the whole idea of privileged, those characteristics and what they look like. When it comes to treatment, the oppressive aspect of if a client's behaving this way, or if a client's behaving that way, they're non-compliant, resistant. Now, see, talking to a Black woman, there are those assumptions because of my presentation and my command presence. You make assumptions about me and you don't even know me. You don't know anything about my story. You don't know. Brain spotting, I don't have to know any of that. All I have to do is be an open portal and ride the wave in the tail of the comet, so to speak. And so brain spotting has this component where I don't necessarily need to know in order for you to access all of you. And not just those traumatized parts or those oppressed parts, but also those gifted parts, right? And because when we start talking about marginalization, when we start talking about concepts like hypervigilance, fact of the matter is when you're looking at someone that looks like me or in other marginalized groups, they're probably dealing with hyper vigilance. So where I'm going with that is nothing really needs, no event needs to take place for a person of color to trigger into or be in that state of hyper vigilance just based upon neuro experiential of what the day-to-day life is. We see the news, we hear what's happening, we know what's going on in our nation and in the world, whether it's based on gender, whether it's based on race, ethnicity, even religiously. Folk have gone up in the Christian church and killed folk. Folk have gone into the synagogues, these things. So anti-oppressive when it comes to brain spotting means you don't have to follow a protocol to receive the benefit of this tool. I like to call it a tool. Sometimes we say modality, sometimes we say technique. It's a hypothesis that is effective because anti-oppression means you don't have to be how I think you ought to be. You can just be all of you. And we're able to engage in that moment with whatever it is you want to address, because the brain goes where the brain needs to go.
Mm-hmm. Mm-hmm. Yeah.
And so that becomes the pin in it for me.
Yeah. Yeah. Well, and I know that I experienced that being in the intersectionality and social justice training, just the sense of the frame growing larger, just that sense of there's more room for all aspects of oneself, the self of the client, just everything's larger, and there's room for all of it and respect for all of it, and that's been just invaluable. As much as I have always loved brain spotting, I just feel like since taking, I didn't bring you here to flatter you, but I just want to say, I feel like I've fallen in love with brain spotting again on a whole other level since that training. So, and I already loved it quite a bit. So, but I do feel like it's been just so rich. And when you're referring to the hyper vigilance, I really, that for me is sort of what brings for me a sense of urgency about getting people of color trained in brain spotting in Mississippi. That sense of wanting people to be able to be safe, in their trainings, in their therapy sessions, and all of that. And I just wonder, can you share a bit more about that brain aspect of why is it so important that BIPOC folks, that other marginalized folks be actually in the chair of the therapist or the clergy doing brain spotting? Why is that so important from a brain perspective?
From a brain perspective, the whole formulating of brain spotting in and of itself aligns beautifully with Indigenous practice. Mm. It's almost as though David tapped into spirit, tapped into ancestors, tapped into the unknown, which aligns perfectly with the uncertainty principle. You can't truly attune and be with uncertainty, right? Because certainty already means that you set a limit, you have a perspective.
Right. I think I know what's going on with this client. Yeah.
And we can't know. And oftentimes, depending on what type of trauma we're talking about, whether it's pre-verbal, whether it's ancestral, generational traumas, whether it's developmental, whether it's personal, whether it's existential, that's a whole lot of different types of trauma. For any one person to even think they have a grasp or a handle on it, because oftentimes we don't know. as the person who's the carrier. And so when we start talking about anti-oppression, when we start talking about brain spotting readily aligning in a highly indigenous way, when we start talking about the brain, when we start talking about, when I use language like spirit, that's not uncommon to indigenous persons. Indigenous persons have had culture from the word go. Indigenous persons have had faith. Indigenous persons oftentimes have been in attunement beyond themselves, understanding that we stand on the shoulders of those who came before us. There's this writing, My Grandmother's Hands, which is beautiful. I love listening to it on long trips. And when, was it Resnick? I always mess his name up for some reason. The author of that book, Resma, when he speaks about the soul nerve, when he starts talking vagally, right? When he starts talking about, he's talking about that nerve that just runs all through our soul. He calls it even the soul nerve. And so if you've got a central nervous system, brain spotting can impact you. Because what we do is brain spotting's a brain body somatic based tool. And so with that being said, when we start talking about the brain stuff, we have from 1 to 4 quadrillion synapses in the brain. All of that becomes an opportunity for new pathways. And so from an indigenous perspective, it's always more about what I feel than what I know, if that makes sense. When we start thinking about even the Native American traditions and how the ancestors are honored and how the body becomes active in that experience, when we start thinking about the African or the Black American, when we start talking about South Central Americans, when we start talking about, I'll go here with you. The Aborigines have survived way before Australia. That part of the world was refined, or people like to say civilized. You know, that, and so brain spotting crosses all those barriers because you're it. I don't bring anything existentially or externally. You're working internally. And if it happens in the brain, it happens in the body. If it happens in the body, it happens in the brain. We don't see out here, we see inside that brain. So when we start talking about the intricacies of the brain, when we start to, subcortically, our spiritualism, our faith is in our subcortical brain, our creativity. You know, so when we start talking about marginalization and oppression, there's a reason for that. And one of the main reasons has to do with difference. What people don't understand, they oftentimes pathologize. Brain spotting takes away layers of that pathology, where we can just sit with whomsoever, right? Under whatever circumstances that they determine for themselves, while being present. And that goes back to the importance of, even as clinicians, of us being aware of who we're taking into that space, who we're taking into that room, because who we are and how we show up can impact. It can impact that healing experience, and it can become a thing of contraction, or it can become a thing of expansion. As a clinician, so with the whole idea of brain spotting and the part of the brain that we address and how the body and the brain is connected, that becomes a sure win for marginalized and persons of indigenous cultures, persons of color. Brain spotting is way more Eastern than Western.
Mm.
So it's a connection that see, because oftentimes we stand in the gap for our clients and we hold that frame. We interject in that frame. That frame's always changing in brain spotting, which means I get to go wherever you carry me.
Right.
And then I lovingly return your frame to you, right? Because the client brings the frame, which becomes all of them. And depending on relationally, how you show up as a clinician oftentimes determines where a client can and will go.
Yeah, that makes so much sense. It also makes me reflect on folks that maybe aren't familiar with brain spotting or don't work with brain spotting and say, oh my God, how can you specialize in trauma? How can you do, and it is that feeling of, well, they're doing the work and I'm, like you said, you're handing their frame back to them when they leave. You're not taking it on personally and making the story about you. So there's not that exhaustion around it that maybe there can be in other situations if you feel like it's your job to change something the client is doing, So I saw that you have a phase 1 training coming up in December, a BIPOC training. Now, I'm almost imagining that even could be full. I don't know if it is full or not, but is there anything in particular that you want your listeners to know about it? If it's not full, but even if it is full, do you know when the next one might be? And who all is eligible? For instance, do people have to be fully licensed clinicians? Who's eligible?
So BIPOC Nation, as David has lovingly named us, directly to respond, I have, I think, like 4 or 5 packets left for the training in December. There's a couple of spots left. If someone really wanted to attend, they're welcome. We'll make it happen. BIPOC, Black, Indigenous persons of color, which sometimes I struggle with a little bit, but we actually started out as the persons of color group. And I think BIPOC kind of came on the scene in light of all that was happening. We had our first persons of color training December of 2019 in Atlanta, whereby I was the legs for that training. It's almost like a love story how John and I were put together, but I know it's serendipity. I know that nothing happens by mistake. I know that spirit was in the midst of us even coming together, that this whole BIPOC situation, BIPOC Nation would even be existent. And so we invite persons of color that do not identify as white, whether they are Latinx, whether they're of Eastern, Western, Indian heritage, Black, Asian, Latin, Hawaiian, Filipino, whatever. It is a space that reduces code switching. At least what I've found is there is a sense of ownership and a sense of being one's full self, not having to code switch and deal with quote unquote whiteness, which is a word, I'm not just using it.
Sure.
It is a term. And so persons of color, even from a mental health perspective, persons of color, marginalized people, even when we start talking about the LGBTQ plus communities, there's empirical data of how marginalized persons, for whatever reason, they're marginalized, whether it's ethnicity, race, sex, age, whatever that looks like, are treated in a way that's right there with traumatic. even by helping professionals.
Mhm.
And so in our BIPOC trainings, it reduces the code switching. People feel that sense of identity, because oftentimes, especially when it comes to persons of color, there's been the thing, which is a concept called erasure, whereby oftentimes even our work is misappropriated and taken, whereby someone of dominant culture receives credit, where we're treated, even when it comes to medical treatment, when we start talking about access, the mortality rate of Black babies is the highest. Well, and Black people receive even less pain medication because we're objectified in such a way and treated less than human, less than fairly. And so what happens in these BIPOC trainings, it's so powerful because Indigenous persons are also about healing in community. And so the whole environment is on like steroids on a whole other level, because if you can imagine having all these Indigenous persons in one area with that energy and holding that space. I have seen some things happen in the BIPOC environment that I have not experienced outside of the BIPOC environment. And David always talks about that, what that experience is, to even be with BIPOC in that way. And so it's almost sacred space, Reverend Christie. I don't know another way to really categorize it, where people get to be all of them, and understand that, especially when we start talking from a race and ethnicity perspective, oftentimes we're the only one, whether Black, Hispanic, those are the major ones, or East Indian or Native American. Oftentimes we have poor representation, you know, even in this field, when we start talking about what that looks like, you know, we're not represented. So for persons to have, you know, representation is a whole other thing.
Mm-hmm. Well, and that leads me to, again, to that question about professionally, what are the requirements to attend?
You know, you don't even have to be a therapist. You don't even have to be a psychotherapist. You could be someone of clergy. You could be a organizer in your community that work with people and encounter trauma. You could be anyone. We don't have a monopoly on healing, and we don't have a monopoly on who the tool is available to. We give access to all, because brain spotting is as such, even not being a clinician, you can learn the skill, the hypothesis, and actually use it and impact community positively.
That's great. Yeah, that is wonderful. Well, and I know that in the world of brain spotting, we have clergy trained, we have physical therapists trained. I know we have, I remember running into someone at the conference who's an ophthalmologist who was so fascinated as somebody with, you know, with background in the eyes. So yes, so thank you for getting that message out. And let's see if I have any other questions. Really, I wanted to be sure. Well, first of all, I think I was so excited. I'm not sure I properly thanked you at the beginning of this interview for your time and for being willing to do this. But so thank you for sharing your vision and expertise with us. And then also, I guess my final question is just, is there anything that I haven't asked about that would be good for folks to know?
So a couple of things. Check my website, which is www.gracecommunitycounseling.com. That's where you will find my intersectionality and social justice training announcements. That's where you will find my BIPOC training announcement for dates. Also, go on my website and subscribe, because it's through those subscriptions, and you can see a subscribe button on both my BIPOC Brainspotting page and on the Brainspotting Intersectionality and Social Justice page. Know this: Tracy, which is me, is all about inclusion. They affectionately call me in community the UN, as in the United Nations. Yeah, John Edwards and Steve Sawyer started that at conference, calling them out. They're both trainers in community. Steve is with the Native Americans predominantly, and John is actually the organizer of BIPOC. And I am about inclusion. The Brainspotting Intersectionality and Social Justice training is open to everyone. The only stipulation is that you would have had to have already had phase 1 or phase 2 brain spotting, because we don't teach the setups at the training. And so you would need either phase 1 or phase 2 to attend. BIPOC phase 1 and phase 2 trainings, you must be someone of Black, Indigenous, person of color classification. If you're not, and you sign up for the training, I will gladly return your funds, because it becomes safe space. People get to, because notice I said at the beginning of the interview, Reverend Christie, that I literally received healing at my first brain spotting training, phase 1 here in Atlanta. And it is a space unlike any other, especially people walking with racial oppression, identity oppression, coupled with being a person of color, gender, age, you know, just when we look at those intersectionality axes, and that's still, as far as I'm concerned, inexhaustive, because there's even other ism, right? And so we address the isms. And with the BIPOC trainings, people have an opportunity to authentically respond and express, which just does not happen in the same way in mixed company.
Of course.
And so it's pretty sacred. Thank you for inviting me. I can't really think of anything you didn't ask. Your interview questions were seamless. They were of honor. You got to the information. And it was an opportunity to share my heart, my vision. And I'm the first Black female trainer in the brain spotting community worldwide.
That's very cool. I had not really recognized that. I guess if I'd really thought about it, I would have known that, but that's very neat. Yeah.
Yeah, it's pretty exciting. And so we're moving by leaps and bounds in this community. And I'm so grateful for David. David has been a DOLL. You know, David is known as my boogaloo. From the first time I laid eyes on him, it's just been a blessing. And I call him friend. And he has been very open and accommodating and willing to learn, and has been so supportive of this BIPOC nation. And he gets it. He understands. And so for me, that makes it even more important that I show up with my best, right? Given this opportunity, to impact lives. And I'm so serious, Reverend Christie, about anything that I am available to do to support your call to action in Mississippi, because there's a whole other ball of wax there that people in Mississippi, some of them don't even know we free. And so I'm delighted. I am a mission field girl.
Yeah. Yeah. Well,
So
thank you so absolutely. Thank you, Tracy.
My pleasure.